Now when I do, with my type of chiropractic, I use a lot of muscle testing because I'm using your body to let me know what's wrong. And that gives me a really precise way of diagnosing whether it's your joint, whether it's your vertebrae, whether it's your organ, whether it's your nutrition, or whether it's trauma that is affecting you, or what areas need to be interrelated so that we can address that particular area appropriately. So there's a lot of information that I'm getting from the body. And I do use my hands a lot. I also use instruments. I have an arthro stem that is very gentle. I can use it on babies. I can use it in the elderly without hurting them, so that you don't have to be afraid of having any broken bones. Or I can use it on football players. Do it, adjust very big people, and so I can, it just depends on the range, and that's how we adjust our adjustment. We can make modifications to our adjustments so that they can be very gentle or just the right thrust for the individual. And a lot of people don't know that chiropractors can adjust the extremities. That's why I mentioned the wrists and the elbows and the shoulders, because we can prevent a lot of surgery sometimes with just the right type of care. Especially carpal tunnel, a lot of times it's just a misalignment. We teach you some exercises, and before you know it, you don't have any more of that numbness. The weakness is gone. Your hands are strong again, and no surgery is necessary. Now when you come in, you're going to see that our examination day is quite extensive because we do a lot of tests. You'll have a spinal scan, you'll have your x-rays, I will do muscle testing throughout your whole body, we'll do nutritional assessment, we'll do a urinalysis. So we incorporate as much as we can to find out what exactly is going on in your body. Even with the urinalysis alone, sometimes we find infections that people didn't even know they had because there's no symptoms. But then it's right there, the bacteria is there, so we have to address it. Because they might just have lumbar pain or back pain and think it's from the fact that they played football, a couple of weeks ago. And it may be that it not has anything to do with that, it's because they have the bladder infection is now rising up. So it's very important that we look at all the different aspects. And if I need to, I send people for further imaging or testing for blood work, saliva, stool, hair analysis. We do all kinds of things. And I think I talked about some of my techniques already, from the traditional that you know about to very low force techniques, to some energy work like total body modification. Very unique, very effective for my youngest patient so far has been 1 week old, and my oldest patient I think has been 96, so everything in between. So if you get regular chiropractic care, you're going to find that you heal faster, you have more balance, you have better recovery from illness and less illness, because your body just becomes more balanced so that your immune system is working properly all the time. And some of the things that we have found is people with high blood pressure, their blood pressure starts regulating normally. People with diabetes, they need less and less medication, or they might even need less insulin. It becomes more controlled. Individuals who had chronic pain will find that their pain is manageable, and then eventually sometimes it's completely gone. And it's not because we're specifically addressing the pain. Because I get people who have fibromyalgia or lupus or multiple sclerosis, And I don't treat the condition. I treat the individual, and as we find something, we fix it either structurally, chemically with nutrition, or with a type of mental encoded memory technique, or laser, or acupuncture. We have so many different tools. We use whatever is appropriate, and then the individual starts getting healthier and healthier. And I did mention I use acupuncture, and I love to use the laser over the acupuncture. And we also have rehabilitative exercise. We have an amazing machine called a power plate vibration therapy. And this vibration therapy will exercise your muscles at 9 times per second. And it really is fantastic for rehabilitating your muscles and improving knee injuries, back injuries. And really the main reason I got it is because it treats osteoporosis. By building muscle, we build bone. And so it's like weight training because you're using your whole body for that exercise, and it builds muscle. So we stop the bone loss very quickly. Now I mentioned that you get a spinal scan when you come in. This is an example of an individual who had the spinal scan done the first day after a fall. You see there was quite a bit of injury in the neck area. And this is the second, about 6 or 8 weeks, a few weeks later, about 8 weeks, I guess. You can see how a lot of this redness is gone, but we have an area that needs to be addressed here, the C1. And then all of these areas here that got stressed. Because of this, the body starts adapting. So the body heals very differently in each person. And you can say, well, why did this get so bad? Well, I asked the body what it wants addressed first, and it wanted all of this addressed, and then I had to come back and get this later. It just depends on how the injury occurs, how I address each person. Every person is different. So you don't all get the same treatment. And a couple months later, you can see how a lot of that stress is gone. So this just shows how you start healing. And it really helps me to show you that it's not just me telling you, look, your bones are out of alignment or your muscles are really stressed. When you can see it for yourself, it really helps, because then I get more compliant patients. And I really like compliance because then I can get results. It's really frustrating when I'm putting everything I have forward for the individual, and then they decide it's not important enough, so they go spend time with whatever, a movie or whatever, and skip their treatment. So I like to see results. So let's see what you learned. If you're feeling really good, are you going to call your medical doctor?
No.
Okay, who are you going to call?
Dr. Tomasita.
Okay. Because it's very important to understand the difference between sick care and health care. So you call your holistic health care provider when you're feeling good, or when you're feeling not so good but you want to feel better, right? That's what we do. Actually, even if you're feeling very sick, we help you feel better. But I'd like to see you when you're better, and then we can get you to optimal. Yes.
Dr. Tomasita, isn't it true that you call your chiropractor even when you feel good because you want to keep feeling good, right?
Absolutely.
Okay, okay.
It's called maintenance, yes.
Maintenance, yes.
Yeah. And, you know, sometimes we're in the same predicament as dentists, because dentists don't want you calling when your tooth has fallen out. They want to see you every 6 months to keep your teeth from falling out, right? Same thing, same principle.
And one other thing, that person who had the fall that you talked about, whose spine was communicating well after 4 months, it wasn't that you just saw her once a month. It was, to begin with, as I remember, once every 3 times a week.
Actually, I saw her 4 times a week for the first couple of weeks because it was such a bad fall. It was like a double whiplash. She slipped in the ice at school teacher, and just really had a computer in the backpack. And so when she slid forward, she went back and then forward, so her computer hit her, pulled her back, hit her back, and oh, it was just a mess. She was just